shoot, what is... Okay. All right, everyone, I'm gonna grab Dr. Patel. We're gonna get ready to go live here, talk about winter skin. Get your questions ready, and we'll get going. Live. All right. All right, Dr. Patel, if you could tell us a little bit about winter and some of the effects that it might have on our skin, the changes we might experience.
Okay, yes. So the groundhog went back in, and it looks like we've got a little bit more winter coming up. And essentially what happens in the winter is our skin becomes a little bit more compromised. We take warm or hot showers, and the water evaporates off our skin a little bit more, resulting in dry, cracking skin. Imagine a muddy pavement that got really hot, and you see all the little cracks in the pavement. That's kind of what's going on with our skin in the winter. And people with eczema or sensitive skin have an even harder time with that. And what we're going to do in the winter is, you'll notice, imagine having those cracks on your skin and having the nerves exposed to the surface. So you get itching, cracking, some scaling, maybe even round spots that are red and super itchy called eczema spots on our legs and our extremities and areas that get a little bit more dry. And this whole process is exacerbated in the winter because we're taking warmer showers, the heat is on, and the water is just evaporating off our skin a little bit more. We also perform winter sports, and we're outside a little bit more, so we're not sweating as much, and the skin's not as moist, and so we get this dryness. So it's super important in the winter to actually change our skincare regimen. We want to use things that are a little bit more moisturizing. We want to trap that moisture into the skin, or trap the water into the skin right after we take a shower, so we don't get the cracking in the skin, and that prevents the itching and the inflammation that can happen with eczema. We do have a really great product that we use. We made it for women who are pregnant to prevent stretch marks, and it's made to be used in babies to prevent eczema. But this product is called Bump to Baby. It's part of our Visha skincare line here, and it's an excellent emollient. It's got a lot of anti-inflammatories in it, and essentially we want to see the skin, it gets healed, the moisture is trapped in, and then since it's safe to use on babies and nursing, we're able to use it all over our body, and it's a great body balm.
So you mentioned eczema. Can you let us know what the signs of eczema are, or what we might be mistaking as eczema, or maybe why we need to go see a dermatologist if we think we have eczema?
Well, there's a lot of products over the counter that say that they treat eczema or they're used for eczema. If you're using products as such and they're not helping your skin, then you definitely want to see a dermatologist, because you might have something else going on that might be a little bit more worrisome, that you need a professional to maybe decide what's going on. So the skin is the largest organ of your body. So when you start noticing changes, brittle nails, brittle hair, more dry, itchy, flaky patches, that's when you go and see a dermatologist. So to find out what exactly it is so that you know what to use. And sometimes that requires a prescription. If you've had a diagnosis of eczema and you don't want to use steroid creams over a long period of time and you want to prevent this, then definitely you want to make sure that you're using products that are going to help and protect your skin over a long period of time. Bump to Baby or the Visha Skincare Bump to Baby would be something that you would use.
How do you personally change up your skincare routine from summer to winter?
Well, I definitely pay attention to what's happening to my skin. So in the summer, I find them a little bit more oily. I'm using a lot more sunscreen or sunblock, and I'm protecting my skin from photoaging and sunspots, and making sure that I don't get any sunburns. So that emollient action of the sunscreen, which should be applied every 2 hours, is very helpful. And in the winter, I'm doing the sunscreen and sunblock mostly to my sun-exposed areas, but because my arms and legs are generally not exposed to the sun in the winter, I have to make sure that I moisturize or use a good emollient daily when you come out of the shower. And that's to fill in those little cracks in the skin so that I don't get eczema. I also have keratosis pilaris, which are those little bumps that people get on the tops of their arms. In the summer, they get really red and itchy, and they become a little bit more apparent where I'm sweating or working out. In the winter, they get a lot more drier and itchy. So keratosis pilaris is a defect in the hair follicle, and essentially what's happening is the hairs are growing out of the hair follicle and the skin's not exfoliating over the top of it, and so it creates these little cones of kind of plugged up hair follicles. For me in the winter, that it gets worse because I'm wearing wool sweaters, I'm covering up my arms a lot more, so I'm exfoliating my skin in the shower. We have a product called the Visha Skincare Sugar Shrink Body Scrub, which is an amazing exfoliant. It essentially has got caffeine, sugar, and lots of beads in it. The sugar granules act as the beads. They're a natural exfoliant. And tea tree oil as well. So this is an amazing sugar scrub. I use it for my keratosis pilaris. It's good for dry knees. It's good for before you go to a spray tan. It's really good to exfoliate the skin for elbows and knees so the spray tan doesn't get too stuck or dark on one area. And it's also got a lot of caffeine in it, so it's got these properties that help shrink the appearance of cellulite. So I love using this in the winter to get myself ready for the summer. And also it helps my moisturizer go on better, and I don't get as much keratosis pilaris.
Great. Can you talk about, you mentioned sunscreen. So even though it's winter and it's cloudy out, why should I be applying sunscreen?
So an SPF of 30 is a must on a daily basis. We definitely have to protect ourselves from ultraviolet radiation. So just because you see clouds and you don't see sun and you're not sweating or burning doesn't mean that you're not getting any kind of ultraviolet radiation. Now, prolonged exposure of ultraviolet radiation, especially in certain skin types, the fairer complexions, for example, changes the DNA in the cells and can lead to skin cancer over a long period of time. Of course, this is compounded if you go to the tanning bed, which is you're increasing your risk of melanoma by 200-fold, or compounded if you sit under a sun lamp, or know that you're getting sunburns over a long period of time, you increase your risk of skin cancer. But there's also ultraviolet radiation breaks down our collagen in our skin as well, so it creates wrinkles. And so there's free radical release, creates wrinkles, increases melanin production in some areas of our skin, which means that we get sunspots, so it increases photo-aging, or the ability to look older. And so protecting your skin over a long period of time, especially starting early in your 20s, is something that's going to help you to not look old in the long run, but also prevent skin cancer in the long run. So we say incorporate that SPF of 30 into your daily moisturizer at all times. Now, sunscreens do come in different flavors. There's chemical blocks and physical blocks. So you want to make sure that you use a product that, number one, you're not allergic to, and I prefer physical blocks. Those are blocks with titanium oxide and zinc oxide in them, because they will actually bounce the sunlight or the ultraviolet radiation right off the sunblock, and so you don't get any absorption.
Great. We actually have a question. You're talking a lot about tanning and self-tanners. Is there a self-tanner you would recommend in the winter months that won't dry out my skin? Also, any tips for helping the tanner last longer?
Yes, so you can help your spray tan. So what is spray tanning? The brown or the pigment that is found, the DHA that makes up a spray tan, was discovered because it's the same sugar or the brown that causes apples to get brown when they lay out for a long period of time. So if any of you guys have eaten fruit and had it oxidize in the air for a long period of time, it turns a little brown. That sugar is what's in spray tanning, or most popular spray tanning. So, and that's what's used in the over-the-counter products as well. So spray tanning, so there's spray tanning that you go to the salon to get a spray tan, and then there's at-home sunless tanning solutions as well. So whatever really is feasible for a person's lifestyle is what I would recommend. Spray tanning is great because you have a professional who can actually airbrush the tan on you, or you go into a place and get it done. How do you make it last longer? It's not that the spray tan is drying the skin per se, it's that the person is more reluctant to put products on it after it's there because they don't want the tan to go away as fast. So some ways to make that last longer or stick onto the top of the skin is to exfoliate, exfoliate, exfoliate before you put the spray tan on, because if you think about it, you're taking all the dead skin cells off and then putting the spray tan on a fresh skin cells, so it's going to take longer for those skin cells to exfoliate off, and so that you keep that color or that glow that you want for a little bit longer. Our sugar strength, the Visha Skincare Sugar Strength Body Scrub is perfect for that. And then of course, after you spray tan, you want to use an emollient. You want to use, for example, our Visha Skincare Balm to Baby, or a really good body balm to trap that color and keep those epidermal cells on the skin. You want to keep that tan color on those top skin cells so that they don't exfoliate off as fast as well. But I would say an average spray tan lasts 2 to 3 weeks at best. And the ones that I like the home, I mean anything over the counter. We have airbrush tanning at Advanced Dermatology, which has an excellent solution. But also you want to pick a color that matches to you. So sometimes when you look over the counter, you'll see L'Oreal has got one, Bain de Soleil has got one. You can get products that slowly will accumulate that color at home over a long period of time. A long time ago, people used to put self-tanners on and mist their in between their fingers and their toes, and it looked streaky, and it wasn't so favorable, I would say, to use a sunless tanning because you could tell that they had done it. Now we're getting products that you can gradually put on your skin over a long period of time, and that's giving people a more natural looking glow. And I would say go for those products so that it doesn't look so dramatic over a long period of time. There's wipes that you can get from Bain de Soleil, and there's different products all over the counter that you can look for that are convenient to your lifestyle that you're able to do. But the ones that gradually build the glow is what I would recommend, because it's easier to do. You can do it consistently. You can exfoliate and moisturize while you're doing the treatments at home, and the color will last as long as you do the product.
Great. We had a few people just joined. Someone said, my hands get very dry in the winter. Is there a particular product or ingredient that is more effective at fighting dry skin, particularly on my hands?
Yes, so hands are mostly difficult to treat only because we wash our hands all the time and we're touching things. So a lot of times you'll end up treating your pockets or your purse or your clothes or your sweater, or if you're putting on moisturizer at night, you're treating your bed sheets and your pajamas. So a couple things in the winter time. You want to use something that's a little bit thicker. The Visha Skincare Balm to Baby is perfect as an emollient. And then at nighttime, I like to say put the product on under cotton gloves. And that way you're getting the product to get trapped into the skin, and you're not treating all the things around you. During the day, it is something, after you wash your hands, you would have to continually apply an emollient. Thicker ones, so you're looking for lanolin and shea. You're looking for ingredients that are actually going to seal the skin that we talked about a little bit earlier, seal those cracks in the skin to help.
Great. So you talked about applying gloves at night. Is there anything else we should add to our nighttime routine for our skin?
For sure. Not just for our hands, for our face. I mean, we must always wash our faces before we go to bed. We must always apply something that's going to help our skin recover from the day, you should say, or repair our skin from the day. For example, Visha Skincare has 2 products that are serums that help with that. Our Advanced Correcting Serum has retinol, vitamin C, vitamin E, ferulic acid, and a natural lightening agent. It's a serum that you put in at night that helps with brown spots, fine lines and wrinkles, hyperpigmentation, or dark spots. Helps boost collagen production, and it also help free radical damage, which is, it's got a lot of antioxidants in it. And then of course we have our Mommy Brightener, which is used for nursing and pregnancy and sensitive skin. That's also got our antioxidants and a skin lightener, something to help with the brown spots and help with wrinkles. So when you use something like that or a serum before you go to bed, you're helping with acne, wrinkles, dark spots. You're getting kind of an all-in-one or a multitasking product. And then if you feel like your skin is a little bit more dry, you can use a moisturizer before you go to bed. And definitely take off all eye makeup and all remnants of any products. If you're a guy, definitely make sure that you've washed your face thoroughly and that your hair products aren't coming down on your face as well.
We had someone ask, can men use Bump to Baby too?
Absolutely. So it's a little bit of a misnomer, and the reason why is because we originally developed Bump to Baby, Visha Skincare developed this Bump to Baby for stretch marks. And the fact that it was thickening the skin and protecting the skin so well on the bellies of moms, we started using it on the newborns right after they were born, because it's such a wonderful concept to be able to use the same product on a belly on the baby once the newborn is born. We found that it was preventing eczema in these babies and then all the way up. And of course, the babies are girls and boys, and they were using the product as they got older, and it was helping thicken the skin and prevent eczema. And then as we get older, it was helping with more elderly patients. So what happens is, like I said a little bit earlier, the sun thins the collagen and skin gets thinner, and there's more bruising as we get older in our skin. So it was helping the same concept of thickening the collagen and stretch marks. It was thickening the skin, and we were able to use it across both sexes and across all age groups. So it's called Bump to Baby, and we may change the name to B2B at some point, just to make it a little bit more gender friendly. But men, absolutely, I have a lot of men use it, mostly because it's easier to use. It's one product that they put on after the shower, and they don't have to think about re-moisturizing their body or worrying about their skincare.
Great. I have really chapped lips in the winter, but my chapstick isn't helping. Do you have any tips?
Yes, so look at what's going on in the winter. Is it because we're licking our lips a little bit more? Is it because we're just out and about and the corners of our lips are getting a little dry? Is this something that you think you need to see a dermatologist about? Is anything affecting the inside of your mouth as well? Do you have ulcers or problems swallowing, or you feel like you're not making enough saliva? Those are things that you would go to see a dermatologist about to make sure there's nothing else going on. If you feel that it's just dry, chapped lips, increase the ability to use an emollient. Sometimes people don't exfoliate their lips too. They don't think about doing that. I use our Sugar Shrink Body Scrub, the Visha Skincare Sugar Shrink Body Scrub, as an emollient for my lips, but some people just use their toothbrushes. When they're brushing their teeth, they'll use their dry toothbrush over the tops of their lips in a backwards and forwards or circular motion to get the dry or the dead skin off, so that when you move your lips, because the muscles in our lips, around our lips, go in a circular motion, when we move our lips, that skin that's thicker doesn't crack, right? And that causes those painful fissures, which are more common in the winter. So thicker things to use. Vaseline, perfect example of something that you can use that's pretty inexpensive at night, all around the lips, including the corners of the lips. And then you could try chapstick throughout the day. Now, chapstick is a wax, so it is helpful, but it's not as effective as, say, Aquaphor Vaseline. Our Bump to Baby, I use it on my lips at night, but I wouldn't use it during the day because it's a cream-colored cream. It's a white-colored cream, and I just wouldn't put that underneath my lipstick.
Great. Someone asked if there's anything they should add or subtract from their diet in the winter that might help with their skin.
That's a great question. So I'm a firm believer, because the skin is the largest organ of the body, that and it's related to our internal organs. It's also, our skin can show us what's going on the inside as well as the outside. I'm a huge firm believer of drinking 6 glasses of water, getting 8 hours of sleep, taking a multivitamin, and taking a probiotic. So a probiotic, why? Because the skin is the largest immune organ of the body. It is exposed to the outside. The second largest immune organ of our body is our gut. It is exposed to the inside, and there's tons of it going on in there, and it's what we eat does matter. So if you're eating a high carb, high sugar diet, you're really stimulating lots of bacteria to grow in your gut. And in this day of antibiotics, where sometimes not the right bacteria is growing there because we've been on an antibiotic, or we're having a little bit of digestive problems because of what we're eating, or overeating, I should say, then a probiotic settles the gut down. A probiotic is going to put normal gut bacteria back into the gut and calm that immune system down, all those little immune bundles that are sitting in our gut, which helps with inflammation. So overall, decrease in inflammation in our body definitely helps with lots of things, almost everything, I should say, including heart disease, because today is American Heart Disease Day, or American Heart Association Day, go red. And so we want to make sure that we decrease inflammation overall. That helps with the skin. It helps with our mouth. It helps with making people who get aphthous ulcers in our mouth, because our mouth is part of our digestive system, and it helps with the skin. Now, increasing fatty acids such as omega-3s, eating a little bit more salmon, vitamin E, increasing your antioxidants such as vitamin C orally or by mouth is also very helpful, because that helps with inflammation. Drinking a cup of green tea a day is very helpful as well. So those antioxidants are helpful to increase in the winter, because you're a little bit immune, your skin's a little bit immune compromised in the winter, but doing it all the time is helpful overall.
Great. What are some of the natural ingredients in your skincare line that might help with an itchy face in the winter?
So itchy faces in the winter, we talk about the same thing, the skin barrier being disrupted, little cracks in the skin, the nerves being exposed, thus resulting in itching. So definitely the Bumped Baby has the shea, it has it's got rosehip seed oil, which is a natural anti-inflammatory. It's got a lot of plant extracts that calm down the ability to create that inflammation in the skin, but the majority of the inflammation is caused by the nerves being exposed to the air, and that it's kind of like when you get a bug bite. It's really painful, but the nerves in your skin are saying that it's itchy. And so people go to scratch a bug bite to distract those nerve fibers from feeling pain because they're feeling itch, and then you're releasing histamine. It's a little scientific, but the same process is going on in the skin. We have nerve fibers that are firing because they're exposed to the air, and instead of feeling pain, which is what we would feel if it was like a big crack, we're feeling itching because we're releasing histamine in the skin. So people go to scratch the skin or rub the skin. So by blocking those fibers or healing the skin and using an emollient to protect the skin from the air, that helps the majority of what's going on. If you feel like an emollient's not going to help the skin when you put it on, then I would definitely see a dermatologist to see if an antihistamine is in order or something else is going on.
Great. Do you have any other random tips that you like to use that some people might not think of? Like you talked about the toothbrush for exfoliating. Any other fun tips that you might have?
I have a ton of tips. So if you kind of point me in the right direction, I can tell you there's lots of things we can do to help. For example, I had mentioned taking off your eye makeup before you go to bed. I use baby oil to take my eye makeup off because it's lipophilic, and it just kind of melts all the eye makeup off, and that way you're able to use a good cleanser. The cleanser I use, of course, are the Visha skincare cleansers. I use the Advanced Purifying Cleanser because it has lactic acid, glycolic acid, and tea tree oil in it, so that helps calm the skin a little bit as well. If you find that you have sensitive skin, our Mommy Skincare Purifying Cleanser is excellent because it has a little bit less acidic content, but it also gets the dirt and the makeup off as well, and it helps with acne just by itself, and it's perfect to use after working out.
Awesome. Someone asked, you mentioned a multivitamin. Is there a brand that you suggest?
Absolutely not. So I think that in today's society, it's really hard to get in all the nutrients that we need. A lot of times because we're relying on outsourced foods, we're not, I mean myself included, not able to cook every day. So we're relying on food that we don't really know how it's prepared or how fresh it is, etc. The multivitamin concept really comes from the fact that because our diets aren't where they need to be, or maybe we're doing a fad diet, or maybe we're increasing this and decreasing that, we just want to make sure that we're getting actual nutrients in our skin. For example, I find that in the wintertime, I get a lot of patients with problems that might be related to zinc or magnesium deficiency. And that can be chapped, cracked lips, that can be dry hands as well, going back to what we talked about. And it's really non-specific. But I ask them questions like, do you crave cheese? Or do you eat a ton of beets? And if they say yes, 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 then sometimes I can say, you know, maybe just add a multivitamin into your diet, because whatever you're not going to use, you're going to urinate out. There's only a few that you're actually going to absorb into the fat of the body, and that's generally not a problem unless you're overdoing it on a lot of those fat absorbable vitamins. So a multivitamin is a safe concept.
Great. You mentioned why you were wearing red earlier. Can you tell us again why you have your red on?
I think today's Heart Disease Awareness Day. So the American Heart Association encourages everybody to wear red or go red on this day in particular to increase the awareness of heart disease. Now, I had mentioned inflammation, and that's a really important concept in heart disease. I think that being a dermatologist and a doctor of the skin makes me kind of a little bit of a doctor of almost all the organs. So being aware of these things is important, and I do practice what I preach. So
great. So besides Facebook, we're on Facebook Live right now. Where else can we find you?
We are at Advanced Dermatology in Memphis. That's our office. We have an office in Germantown, and we also have an office in Olive Branch, and we're building a new office in Arlington currently. You can find us at vishaskincare.com, which is where our skincare line is located, and you can find us on advanceddermatologymemphis.com.
Great. Well, thanks for sharing all your winter tips
I hope this was
skin
helpful.
tips. All right. Have a good day, everybody.